So in terms of maintenance therapy after autologous stem cell transplant, the field is looking to understand whether all patients need to continue maintenance therapy forever or whether that's something that could be stopped earlier. So Myeloma XI was a trial that included a randomization between lenalidomide maintenance or observation after autologous stem cell transplant. And the trial overall showed that there was a great benefit to having lenalidomide maintenance compared to observation, and indeed that's now standard of care in many countries around the world. One of the key questions is whether that lenalidomide maintenance needs to be continued until patient's disease relapses or progresses in the future, or whether there's a certain time period after which patients could safely stop lenalidomide maintenance. And so we looked at the data from the trial to try and explore whether we could contribute to answering this question. And so we looked at patients 2 years after starting maintenance, 3 years, 4 years, up to 5 years after starting their maintenance therapy. And we can see that there's clear evidence in the overall population of a benefit of continuing lenalidomide maintenance beyond 4 years. But when we look at patients who have sustained MRD negativity, so when they have minimal residual disease not detectable over a period of 6 months, then it appears that after around 3 to 4 years, maybe the benefit of ongoing maintenance might be diminishing. And so that seems to be the right kind of time point that we could maybe think about designing clinical trials in the future to randomize patients who have sustained MRD negativity to either continuing or stopping lenalidomide maintenance in order to truly answer this question for patients. So at the moment, I think the standard of care for the vast majority of patients is to continue lenalidomide maintenance until disease progression, unless they're unable to tolerate the treatment because of side effects or another reason to need to stop. I think our data really supports the design of future clinical trials to try and really pinpoint whether or not it is safe to stop lenalidomide maintenance earlier. So the only way we can truly answer the question is to do a randomized trial of stopping or continuing lenalidomide maintenance, perhaps after a period of sustained MRD negativity in patients. So that would be a randomization between continuing lenalidomide or stopping at a defined time point. And our data suggests that in patients with sustained MRD negativity, we could think about designing that trial around 3 years after they've started the lenalidomide maintenance.